Medical Dilemma.
Welcome back to Medical Dilemma. Again, we'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment of the show are my co-host, Attorney Sara Sugitan. Welcome back to the show. We missed you last week.
Yes, thank you.
And Father Jerry Manlangit.
Yes, sir.
Okay. Father, we also missed you last week. Okay, and of course, Doctora Teresita Sanchez.
Okay, hi.
Now, before we took the commercial break, we were talking about the abuse of the use of ultrasound as a diagnostic tool. Dr. Chua, could you please explain further what do you mean by the abuse of the technology?
Well, as I was saying earlier, clinicians now tend to depend on ultrasound for their management decisions, no? Without even examining the patient, they send the patient to the ultrasound unit or the ultrasound section, and based on what we see and what we report, then they already make the management decisions. Like if we see a myoma, so we measure the myoma, the tumor in the uterus, and then when the patient goes back to them, they would say, look, you have a myoma, and we need to do surgery on that. Without looking at the patient and seeing whether the patient really needs to have that myoma removed or not. We remove myomas only when they have pain, when they have abnormal bleeding, when it's growing at a relatively fast rate. But if it's a small myoma, it's relatively stable, doesn't grow over time, over 6 months, like for example, then that myoma does not need to be removed. So that's one way that it could be abused.
Yes, but you know, most of the time, the ultrasound is really a very accurate procedure,
Yes.
no? And people tend to rely on the results of this.
Yes, yes.
Kaya nga, but really, I think it's anathema, really forbidden to really request just because for the sake of requesting and not even examining the patient.
Exactly.
Unless
Yes.
very busy yung doktor, nauna doon. O kung minsan yung pasyente mismo, inuuna niya yung ultrasound,
Yes,
no? Even
yes.
without the doctor's
Yes,
prescription
yeah.
pa, di ba?
Yeah, and that's why I say somehow ultrasound has really become run of the mill already. No, patients go to the unit, to the ultrasound room.
Sila na
by
nagda-dive.
themselves, sila na mismo. Gusto ko magpa-ultrasound kasi masakit ang puson ko, things like that.
Yes,
So
in-
they
in
think
fact-
ultrasound will give them the diagnosis.
But I have a question, Doctora. Should it not be like a normal standard of care to have an ultrasound when it is available in the hospital? What do you think? I'm sure in the provinces sometimes wala naman sonologist, wala naman ultrasound machine, pero supposing it's available, don't you think it should be an adjunct? Like for example, in appendicitis, most surgeons tend to depend on this finding of the ultrasound to be sure that there's really appendicitis.
Yes.
Because sometimes whether if they operate na wala palang appendicitis, mali sila. But if they don't operate and the appendix ruptures, ang sama rin, di ba?
Yes, yes. With the more modern machines now, they're not the surgeons or the sonologists who do gastrointestinal ultrasound are now able to make a diagnosis of appendicitis based on ultrasound.
Yes.
But for us gynecologists, it is done more to rule out other gynecologic causes for that right lower quadrant pain.
Yes,
Because it could happen that the pain is not really appendicitis but a ruptured ovarian cyst, or it could be an ectopic pregnancy, a pregnancy outside of the uterus,
Yes,
or it could
pan-emergency
be
nun.
yes. So if the ultrasound we do, the gynecologic ultrasound we do, rules out those, then for sure it would be appendicitis. So it's done more for clearance that there are no other gynecologic problems in that particular patient coming with right lower quadrant pain.
So,
Yes, Father.
Yes, while we marvel at the fascination that we have with technology, while we acknowledge the fact that technology has given so much help to all of us who are unable to see what is inside, and as you have mentioned, that there are things that probably doctors must be able to, to be guided as far as their ethical obligation on the patients. No? Now, with modern times, it looks like that the doctors have already given up what we call the clinical eye.
Yes. Yes,
Yeah.
yes.
Which from the very beginning in their medical studies, that is one of the things that professors, instructors would like to develop among them.
Yes.
Clinical eye, especially so, Doctora, no,
Yeah.
if you are assigned in the province and
Yes,
where
yes.
you don't have technology,
Yeah.
the clinical is very important. But you see, with the coming of technology, it looks like that it has already substituted the clinical eye.
Yeah.
And you know for a fact that in the States, you know that 60% of the procedures using technology were useless, and it has become
Useless.
very expensive
Yeah.
for the patients. 60%, which are unnecessary and could have been done through the
Just
clinical
by,
eye.
yes.
Yes, doctor. Because I have seen this, I have had what you call this a residency as far as my hospital administration is concerned in the States. And we have been told about it. That's why insurance policies have become very expensive because of this. And of course, we cannot fault the doctor for being so, well, careful because, well,
The litigation.
the litigation,
climate.
etc., it has become very expensive.
I see. But in the case of ultrasound, isn't it? It's
not
so cheap
expensive,
now.
yeah. It's not
And
really
in
that
fact, you can
expensive.
actually go into a mall and you will find a diagnostic center that offers ultrasound services, which is not very, very expensive. So in my simplistic thinking, I think it's actually good for patients to walk in and ask for an ultrasound even without the
seeing a doctor,
advice
yeah.
of a doctor.
Or even
Well, yeah, that's possible. But again, I would like to see a win-win situation where the patient is first seen by the clinician,
Right.
a good clinical history is made, and a good or working diagnosis is made before requesting for the ultrasound, because sometimes the ultrasound is not needed. But again, I agree with Attorney Doctora Tess Sanchez that women, I do believe that women deserve at least one ultrasound examination every year.
Yeah.
Because there are some things that we don't feel with our examining fingers, like a beginning ovarian cyst, which could turn out to be an ovarian cancer later. So if you see that cyst that's still small, it will not always automatically be a reason for surgery, but what you can do is you can monitor its growth over every 4 to 6 months, maybe monitor and see whether it's enlarging rapidly or it's steady or it's even regressing in size.
Yeah,
And then
that's
the clinician could ask for further. We now have what we call the tumor markers. No? These are blood exams, which if they're high, then that would point more towards a malignancy. If it's low, then it's probably just a benign cyst. So all of these tumor markers plus the ultrasound monitoring will now work towards the benefit of the patient.
Yes.
And it will result in an earlier management if it turns out to be non-benign.
I think really the diagnostic procedures like that are really very helpful, especially for those patients who are shying away from doctors. They don't want to pay the consultation fee or anything else, and then they see this, or they decide for themselves, which
Well,
of course is not properly correct, but it's better than nothing, I guess.
But again, something also comes up. In the ultrasound room, they say, Doktora, nag-o-opera din ho ba kayo? And so they begin asking us questions because they know we are also gynecologists.
Okay.
So they begin asking questions. So sometimes it's very hard for us to say, I'm sorry, I'm not going to answer that because
Yes.
my role here is only as a gynecologist. It's very, very hard for some sonologists who are also gynecologists to turn down a patient who will tell her, Doktora, sa iyo na lang ako magpapa-opera or magpapa-ano.
yeah, that's-
So again, the
That's
ethical,
the ethics.
ethico-moral
Right.
aspects
Kasi
of that.
they do have
of that,
usually their
ano,
own
yes,
doctors. Yeah.
Yes, yes.
Ayun.
Mamaya sasabihin,
Sobrang bait
inagaw
That's right.
yung
Oo,
pasyente ko ng
na-pirate.
sonologist na pirate. Pumunta ako dyan sa clinic na yan, nakuha yung...
That's right, that's right. Those things come up and it becomes messy afterwards. No?
Yes, yes.
Although every patient has a right to go from one doctor to another,
Yes.
but sometimes there will be an ethical problem when, well, these things would come up. Na,
Yeah.
si doktora kinuha yung pasyente.
Yeah, tama.
Yes.
And
Inagaw.
professional conflicts come in.
Yes, yes.
And sometimes among professionals, it lasts years and years
Ay.
Oh, yeah, may
afterwards.
samaan ng
Oh, yeah.
loob, ano?
That's very,
Right.
very true.
I have experienced that in my hospital.
But shouldn't the choice of a patient on his or her doctor supersede, professional?
Yes, of course. It's always the
ethics?
decision of the patient, no? But you see, there are gray areas there. that you must be able to see, no? Because the other doctor whom you probably have refused, the first doctor whom you probably refused, and now you go to the second one, well, will think something, bakit kinuha niya? He was my patient. Probably, it would have been good if the first doctor referred it to another. Although, the balance between the patient right and physician's right, that has to be, tailored in such a way that, conflicts will be avoided. Professional conflicts would always be there. And it is devastating on the profession.
Yes, and it happens not only in the ultrasound or diagnostic center, no? Maski na sa hospital, sometimes, these things happen. But
Correct.
From the business side of view, point of view, talagang dapat yung doctor will not accept.
Yes.
Because so that you gain more patients, more doctors will refer patients to
Tama.
your...
You're right, you're right.
That's
And that should have been very professional on the part of the second doctor, no? Okay.
Yes.
He should not. But you see, he would say, gusto na ako ng pasyente. I don't like also
Still,
to refer.
palusot lang yun, palusot lang.
Yeah.
I think so.
In the ultrasound room in the ultrasound unit, we have made it a rule. Never, kahit humiga,
Good.
I mean, maglupasay na dyan, crying
Yes,
tears
right.
of blood.
You really-
Do not give in to the temptation to get that patient for
it's-
yourself.
Yeah.
And
Yes.
they're not that common,
That's-
pero
yeah.
masisira
It
yung
could
reputation.
happen.
ng-
And in which case, hospital policies
Yes.
must be
Policy ho yun.
articulated.
Yeah,
must,
it's a
be,
policy.
must be articulated. Because this is where you'll be able to avoid a lot of conflicts among professionals.
But if the exchange between the patient and the doctor takes place outside of the sonology room, would that be acceptable?
Mabibisto ka pa rin eh.
Yeah, ano
Malalaman
talaga,
din
it's
Right, right.
very tricky, very ticklish. It's
Very
a
ticklish situation.
And it's not worth it sometimes. So doctors should not be tempted to do that.
But you see, there are also doctors who also, advocate this thing now. Well, if a patient leaves you, thank him.
Bagay.
Thank
Oh,
him.
yeah.
No, there are
Why?
doctors who are
Well,
like that.
You thank him.
You thank the patient for having gone to another doctor.
Baka
We know
makulit,
different
baka makulit
attitudes
yung
also
pasyente.
among doctors because these attitudes are not supposed to be subject of policies because this changes from time to time. Now you'll never know what's going to happen afterwards. No? But the attitudes of people, no, you cannot articulate them into policies.
I see.
Di ba sometimes when we do a difficult surgery,
Right.
sinasabi natin, ito dapat binigay ko ito sa aking enemy. This is the kind of
Right,
person I
right.
should have given to my
There are people. Although they don't say that.
Sometimes, no.
It happens.
We
But
say it in
Because,
jest.
In jest, yes.
yes. Kasi talagang difficult case.
Mga difficult
very
cases.
difficult.
Right.
Prone to so many
Yeah,
things.
I see.
Yeah.
All right, so we'll have to take another break in our discussions. Don't leave this channel. We'll be right back again after a few words from our sponsors.
Nako,
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Imagine it when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?